Well, hi, everybody, and welcome to Organizing Life's Daily Demands. My name is Peter Gordon, and I am the president of New York Financial Organizers. We're daily money managers, and we help people organize their daily financial demands and other services as well. But I like to do this podcast so I can interview people who can help my clients and other listeners with other issues in their life. And today I have a wonderful guest, and her name is Dr. Gerda Maissel. And I will go by her tagline, Dr. Gerda, the medical Sherpa. And hi, Gerda, how are you?
Hey, Peter, I'm fine. How are you?
I'm good. So let's just go right off the bat. What's a medical Sherpa?
So I'm a professional patient advocate. And what I do is I help people with complicated medical problems navigate our healthcare maze.
I like how you say that, because that word navigate is really important to me. I got into my business because I met a geriatric care manager who helped my parents navigate the difficult waters of geriatric care. That's what I've always said. And so, I mean, I love your service. I've referred you a few times. I don't think it's ever really connected, but that's the way life works.
Okay. I
But
appreciate that.
I know the dire need for what you do, and I think it's really great. So, before we go into the nitty gritty of it, how did you come about to do what you're doing?
Well, by background, Peter, I'm a physical medicine and rehabilitation physician. And I worked clinically for quite a few years, and I got pulled early and often into administration. And then I spent 10, 12 years doing C-suite level work in health systems. So chief medical officer, chief transformation officer, and my last job, I was a medical group president, about 500 docs inside of moderate-sized health systems. And during the pandemic, I really got tired of the corporate role, of some of the things that I was expected to do, and decided that I really wanted to both get closer back to New York, where my mother is, and get back to my roots of helping people directly. I saw so many people. Often there was a quality complaint or a lawsuit with one of my docs. I saw so many people get frustrated by the communication from the health system, by not knowing who to trust. And I really wanted to relieve the suffering of families and individuals dealing with complicated medical problems.
That makes sense. It's a huge, huge need. And so, what type of things do you do for your clients?
Well, it does depend individually with what they need. Often I am the translator. So I'm helping my clients know what matters. So I help them understand some of the medical information. But more importantly, I help them know how to ask their doctors questions in a way that the doctor can hear what the family or the patient is trying to ask, because there's a lot of miscommunication. And
What do you mean by that? The doctor can hear what they're trying to ask.
So many times doctors are listening for key pieces of information, and that's not clear to the patient or the family that's answering the question. So I'll give you a small example of that. I had a client who had abdominal abscesses, and he was in talking to his surgeon, and she said, any nausea, vomiting, or diarrhea. He took that to mean, tell me about your GI system. And he went on to describe the constipation that he was having to her. She interrupted him. He went back to talking about the constipation, and the doctor started to move on. I watched her disconnect from her engagement with this patient. Now, I knew what she was looking for were signs of infection. So I ended up interjecting and saying, no fevers, no nausea, no vomiting, no other signs of active infection. And she said, oh, okay, good. And then she re-engaged.
Interesting. Now, logistically, where were you? Were you in the room? Yeah.
No, I was actually on the phone, but I can make
Okay.
myself known on the phone.
Oh yeah, yeah. No, but yeah, no, I wasn't sure. And you do Zoom as well or video?
Yes, that one
Yeah.
happened to be a video phone call. So I
Yeah,
wasn't
that's what I figured.
physically, but I could see the doctor literally lean back and turn away from the patient, my client.
Wow. Wow. Yeah, so often I tell people, and people tell me, family members, and we tell each other, because when you're a patient, you forget often what's involved. But you should always go to an appointment with someone else if it's really important, because as the patient, you're often almost removed. You don't follow, and you certainly can't remember. So it's really good to have someone there as an advocate. And I couldn't think of a better advocate as someone like yourself who's trained, as opposed family members are fine, but you know the questions to ask, which is really, it's wonderful.
And in this case, his wife was there, and they're both smart, intelligent professionals. But just because you're a smart, intelligent person, there's no way you're going to know the subtext. And when I first started doing this, I thought I was just going to be doing what we call medical literacy, just explaining conditions. Well, it turns out a lot of the translation that I do is really about the subtext. So let me give you another example. If your mother, father, loved one is in the hospital and the doctor approaches you and says, what's their code status? So code status means, is this person a do not resuscitate? If the heart stops, do you want to
Okay.
do pump on it, or,
I've
do
never
not?
heard it called that, and I hear that all the time. That, in other words, yeah,
Yeah, they might ask the word, is your loved one a DNR? There's different ways
exactly.
the
Is
question
there
can
a
be asked.
DNR? That's what the term I've heard. But
But if a doctor approaches you and says, is your loved one a DNR? There's a huge subtext to that question. The subtext is, I'm worried your loved one is about to code or they're in risk of passing away soon. And I want to know whether I should be getting the code cart ready. And many people hearing that question would just say, oh, yeah, here's what his status is. And I use that as an easy to understand example, a common example of subtext. The doctor, in some ways, is asking, is this person ready to die?
yeah, now what did you mean code card?
Code cart.
Oh,
So,
cart. Ooh,
so if
I
somebody
understand.
needs to be resuscitated, we have a whole cart of
Yeah,
drugs and equipment that we bring to the
I,
bedside.
I understand. Wow. Yeah, I mean, these conversations are interesting. It brings me back to the many times I've been, whether it's been with family members or, unfortunately, it's often with clients. And it's really critical to have. The last time I did this with a client, I was actually with a doctor. And it was an interesting exchange, and that's again why I think what you have to offer is so valuable. It's really valuable. Um, was there any particular event that you decided to that like precipitated your decision to make the move to working with individuals?
Well, I think it was a combination of a few things. Personally, for me, it was the pandemic. I was down in Florida. I had come up for the summer, so summer of 2021, 2020. I'm losing track of the
2020.
years.
2020.
2020. And my elderly mother was not doing well. She was up here in New York and she was very isolated, and that was really pulling on my heart. And in the fall, I had somebody call me the person who became my very first client through a friend of a friend. They called me, and this was a man whose wife had become a quadriplegic, and then she became on a ventilator. And she'd gone through rehab, and now she was in a nursing home. And this poor man was absolutely besides himself. And and this is a grown man, and he's on the phone and he's choking back tears. And he says to me, "They're killing my wife.
Yeah.
Can you help me?" And of course I had to help him. And I ended up getting involved, and he had me look at medical records, and I ended up talking to some personnel there, and it became clear to me that the medical care was substandard. And he was right. If nothing had changed, she would die. And we ended up getting her out of there, and eventually we got her home on a ventilator.
Wow.
And she did eventually pass away, but she had several really good months at home. And I found that experience just so gratifying because I made such a difference. My presence in their life, the husband and the wife, made such a difference that I realized I need to get back to helping people. Cutting budgets is
Yeah.
not fun. It's much better to bring meaning, to be available for my mother, and to get back to helping people. And I knew that as a rehabilitation physician and a person who'd done leadership, that I had this unusual skill set of both understanding the finances and the economic drivers and the medicine behind how people recover after illness or injury. And I thought, I've got this skill set. I should do something good with it.
Yeah. As you said that, I realized the common denominator to oh, absolutely most of the guests on this on my podcast is that they want to help people. We're in business to make money, but we choose what we do based on other considerations, and it's certainly to help people. And that's why I love what I do, because I know I make a difference in people's lives. And so I don't see
That's
you
great.
as a corporate person, but
Oh,
that was a different lifetime.
I did it for a long time. And as I've gotten older, Peter, something that I've started saying when people talk about, this decision to leap out of employment that I'd had for my whole life, is that if you're really lucky, you find something that you have a passion for, that you love to do, that you're also good at, and you can get paid for it. And
Yeah.
when those three things line up, you got to do it.
Yeah, I couldn't agree more. That's kind of where I am in my career and in my life. I feel really fortunate about that. Could you give another example of something that really changed? Because of your work as my MD advisor. By the way, that's the name of your company, my MD advisor.
It is. So another example was I had a client whose wife was in a rehabilitation facility, who would just scream all day long. She would scream, "Help me, help me, help me." And the poor woman was just suffering. And she would calm down when he was there, and he could usually bring her back and redirect her. But then she often screamed at other times. And I ended up reviewing her medications and I'm not her doctor, but making suggestions to the doctor on some medications that could have been triggering the delirium. I ended up making some suggestions about sleep and sleep interruptions and a whole variety of things. And her delirium cleared. And
Wow.
she had been screaming, "Help me, help me, help me," for weeks to months prior to my getting involved. And the husband said to me, he said, "I can't thank you enough. Thank you for getting my wife back."
That's amazing. That's wonderful.
So
And
it was great.
it's not unusual to hear those type of outbursts when you go into a hospital. And I'm always curious about that, and I guess the beauty of it is that, if somebody's able to hire you, you can spend the time with a client as opposed to the doctor who's in a hospital. But I imagine what the work you do is not limited to hospitals.
No, it's not limited to hospitals. And, just keeping in mind, I'm never their doctor. I'm just using the clinical knowledge that I have to either directly or through the client make some suggestions for the doctor to think, to help the doctor consider other options. And the vast majority of the time, the doctors are very receptive to something boiled down to, oh, here's an option, because they don't have the time. And it's one of the reasons why doctors are so burned out and frustrated, is that they want to help people. People go into medicine to do good things. But when you've got, in an outpatient setting, 10 minutes per patient, or in the hospital, your first day on, and you could have 20 plus patients as a hospitalist, it's impossible to know everything about each patient. And so, to answer your question, yes, I help people often in hospitals or rehabs or assisted livings, but of course, I certainly help people in the community as well.
Right, right. Is there any, like, who should call you? How would that work? Who would hire you?
People tend to hire me when they have this feeling of being overwhelmed or frustrated with medical care. If something is straightforward, you and your doctor have excellent communication, you only have a couple of doctors, you don't need me. But when it's complicated, and that's part of why people often hire me in the hospital, because you may have these days,
Yeah.
unfortunately, the doc of the day or the nurse of the day, and you need somebody who can really know all the specifics, see the patterns, and cut to the chase in helping identify which things matter and which things don't. So it really comes down to people that feel frustrated and overwhelmed and recognize that they need professional help. And I don't mean to make it sound glib, but
No.
that's what I offer is help out of the fog, reduction of the suffering that families go through when they're overwhelmed by a medical situation.
Yeah, it's interesting because it reminded me of something you helped me with that I had a feeling you wouldn't remember. We were just
Yeah.
talking. I went through 2 surgeries this year, one with my cervical spine and then with my lumbar. And I don't know, I was like 6 weeks out of my second surgery, and we were talking about it, and I was frustrated. And you were like, it takes, I think you said 18 to 24 months to heal from a surgery like that, or maybe it was 12 to
I
18
don't even
months.
remember what I said, but I'm glad
Yeah,
whatever it was helpful.
it was very well. I have to be constantly reminded of that because I'm keep on pushing myself. But yeah, no, it's so helpful to get knowledgeable, feedback from others, and I mean, I think your service is wonderful, and as I mentioned, I bring it up to people all the time. Just you can bring a horse to water, and see what goes from there. But thank you so much, Gerda. That was wonderful.
My
I hope
pleasure,
people hear
Peter.
this and take notice of it. Your information will be at the, um, in the details in the YouTube video, as well as on the podcast screens, and that's it. So thanks very much.
Oh, I'm
Gonna-
sorry. I was just going to say, if somebody isn't sure if they need my services, I'd rather they just gave me a call. I don't charge for an initial call. And sometimes they just need something simple. Like it sounds like you just needed some simple advice. And that's all you
Absolutely.
need. There's no charge for something like that. But if it's more
Yeah.
complicated, then we get in a business relationship.
Right. Well, and then I know I kind of have the same thing. I don't really charge people for a quote unquote consultation, and I think for what I tell people is also I'm an expert at what I do, but the great thing is I know all the experts elsewhere, within the world of senior care, which is why I want people to talk to me so I could refer them to people like yourself and other
Exactly.
experts I know from this. And
Exactly.
that's critical. That's really critical.
Well,
Um,
thank you, and I do hope you're feeling better and that you're
a little bit every day. You
that's
know,
right.
that's not the purpose of this podcast. Is to talk about my issues, but it takes work, and an aging body is very different than what I'm trying to move as much as I can every day, and that makes a big difference.
Well, it will.
Yeah. Well, thank you so much, Gerda. Have
My
a very
pleasure.
wonderful holiday,
You as
and
well. Thank you for
and every,
having me, Peter. I wish you the
my
best
my
holiday
pleasure.
possible. Thank
Thanks.
you.
Take care. Happy New Year.
Happy New Year.
Bye bye, everybody.